Welcome to the Up Podcast, raw real talk on everything young parenting.
From self-care, co-parenting, and family planning, to balancing school, work, relationships, and goals.
Together, we're challenging society's assumptions and building a safe and supportive community for young parents.
One honest conversation at a time. So join us on the journey.
Hey guys, welcome back to another episode on all things young parenting. Today we are having a part 2 with the legendary Dr. Mays, continuing the conversation on sexual and reproductive health. So as always, let's jump right in. I'm Divine.
Andy, and yes, we are so fortunate and grateful to have Dr. Mays back to continue answering y'all's questions, continue answering our questions, and then continue just, debunking some of the misconceptions that people have around our bodies, around birth control, around STIs, and just overall reproductive health. So thank you for coming back, Dr. Mays.
Thank you so much. I'm so happy to be here. Happy to be here again. I just really love the Up podcast, and I am down to be here anytime. So really happy to be back in this space with you all. And I love the conversation we're about to have today.
Yes, don't tempt us with a good time, Dr. Mays. We will have you back every week, okay?
Right.
Okay, so let's just jump right into the deep end of the pool. I think, last time we talked, we really started to lay the foundation of what it looks like to have sexual readiness and what it looks like to just, know that you're ready and know what's happening with your body and menstruation and all the things. So today we want to really kick off talking about birth control.
Yes.
And looking at different types of birth control, looking at some of the misconceptions about birth control, answering some of our, social media questions about birth control. So our first kind of question is, how soon? So because we're a young parent podcast, our community is all young parents, right? So they've all had children to some degree, whether it be a month ago, a week ago, or 3 years ago. And so how soon after giving birth is it safe to start birth control? And is it safe to start non-hormonal or hormonal, or kind of what are the different types of birth control that we should be thinking about, especially after having a baby?
Yes, I love this question, and because it comes up a lot and it's so important. And something we talked about in our last episode was how whatever method you choose needs to be tailored for you. It needs to be the best method for you, and a method that may work for your friend or family member may not be the best thing for you. And we know that all birth control methods are safe, and it really is just a method that works well for you and your body, and kind of how you like to use your birth control. So, I'm going to answer that question in a lot of different ways, because there are, again, with all the different types of birth control methods, they can be used at different times after pregnancy, and all birth control methods have different effects on the body and can have a different effect depending on whether you're breastfeeding or different things like that after your pregnancy. So I'm going to start off generally with I'm going to be showing a lot of things today. So I love samples. We love giving examples and samples at Dream. I'm actually here in our clinic now in our exam room, and we have a beautiful baby and mom there. So we use our space to really provide information and education all the time. And this is actually one of the posters I actually pulled off the wall just now. And so I don't know if folks have seen this, if you've seen this in your provider's office, but this is a really great one-page flyer that shows the different types of birth control methods. This one says how well do they work, but we actually know that all birth control methods work well if you take them the way they're directed to be taken. And so I don't want folks to feel like the ones up top work better than the others, because they really all work well, and it's really choosing the method that works best for you. So just in general, specifically to answer that question, it really depends on what your goals are for after you have the baby. So after you're not pregnant anymore. And usually while you're receiving prenatal care, your provider should be talking to you about birth control in your third trimester, so that you've been talking about it. You can ask your questions. You can look at little flyers like this. You can look at samples, and you really are informed and can ask questions about your method. if your provider is not talking to you about it in third trimester, so third trimester is around like your 7th month of pregnancy, your 8th month of pregnancy. That's what we think about with third trimester. If they haven't brought it up to you, bring it up to them. Hey, I just want to know, is birth control safe for me? What should I use? And what should I be thinking about? So that you already have a really nice plan afterward. So let's start with some of the common things that people choose. And again, all birth control methods can be used after pregnancy, and they may have a different effect after pregnancy. So for folks who are wanting to breastfeed, so if you know that you're wanting to breastfeed, you want to try breastfeeding, you that's something that feels really important to you, there are specific birth control methods you can use, and there are some birth control methods you shouldn't use while you are breastfeeding, and that's because it doesn't allow the most milk to be produced in the breast, not because those methods are not safe. So those are methods that have estrogen in them. And so when we think about birth control methods, usually we have birth control that have hormones and some that don't have hormones. And the birth control methods that have hormones usually have estrogen and progesterone. Those are two hormones in the birth control, or just progesterone. So I'm going to show those quickly. So our estrogen and progesterone, those are called combined hormones. Birth control are birth control pills. So there are different types of birth control pills that have estrogen and progesterone in them, 2 pills. And that is the most common birth control pill that most people take. So when most people say, I'm on the pill, or I'm taking the pill, usually it's a combined birth control pill that has estrogen and progesterone. The other birth control that has estrogen and progesterone is the patch. That's also a really common one. That's the one we wear once a week. So the patch, again, is a combined. Also the ring, the NuvaRing, that's a combined as well. So anything that has estrogen in it can reduce the milk supply. So it's not a birth control method that we recommend for moms who are going to be breastfeeding. They can certainly use it after breastfeeding, and like I said, it's very safe, but not something that we recommend during breastfeeding. But that leaves a lot of other methods that can be used during breastfeeding. So I'm going to show those now. So this is an example of there is a type of birth control pill. It has progesterone only, so no estrogen. So the most important thing, if you remember anything, for if you're going to breastfeed, no estrogen. You just want progesterone. So this is a birth control pill that has just progesterone. And so this can be used very safely, again, in breastfeeding. It doesn't have any effect on how much milk you make. So all the birth control pills are safe. It's really just depending on how much milk you make. So progesterone only doesn't affect how much milk you make. So if you want to take the pill, a progesterone only pill. The different types of progesterone only pills. So the O pill is a progesterone only pill. O pill is also over the counter. You can buy it at the pharmacy without a prescription. You also can get a progesterone only pill from your provider and use your medical insurance. So you don't need to buy the birth control pill. You can also use your medical insurance for progesterone only pill. Depo. So Depo is a really, really common birth control that a lot of young people use before pregnancy, after pregnancy. It's progesterone only. So Depo can be used, and it does not affect your milk supply when you're breastfeeding. It's a little vial here, and so that's really safe. And so the Depo is once every 3 months. So the nice thing about Depo is that you can come into the clinic and get your Depo shot, and you don't have to come back for 3 months. So this can also be helpful, especially in those early months where you might be really busy, or you're, learning, stepping into being a new mom, and like it may be hard to remember to take a pill every single day. Maybe Depo is something you might want. Some people take medicine every day for things, other things. You might still be using your prenatal vitamin, which is completely healthy, just for overall health. You might be taking an iron pill. So you might just be like, I'm just going to take another pill with that. So it really is what works best for you. Some people like taking a pill every single day. So progesterone only. The other type of progesterone only are the IUDs. So the Mirena IUD. So the Mirena IUD has hormone on it, and it's progesterone only. So this can also be used without affecting milk supply after pregnancy. So there are 3 types of progesterone only IUDs: Mirena, Skyla, and Kylena. And those can be used up to 8. So Mirena can be staying up to 8 years, and the others are a little shorter, but they can be used for years. So you come in and you get them placed. And we'll talk more about this, especially after pregnancy, because there's different times when these can be placed after pregnancy, just so they don't fall out. The last one I'll talk about is the non-hormonal. So we talked about ones that have hormones. Those are all progesterone. We'll talk about the ones with no hormone, which is the Paragard IUD, also called the copper IUD. It's a little sample here. So you can see there's copper right there. So the copper, so there's no hormone on the copper IUD. Some people want a method that's like feels natural to them, no extra medicine. The copper IUD is one an offering for that. And copper actually kills sperm. So that's how it works. So the IUD goes inside the uterus, the copper kills the sperm, and you have no hormones there. This can be used again with breastfeeding. And of course, condoms. So condoms will also give you pregnancy protection. They also give you STD protection as well.
Thank you so much for that. That was an amazing visual demonstration alongside of your descriptions, which I think is going to be super helpful for our community when navigating those times. I really appreciate when you said how important it is on having those conversations beforehand with your doctor, like in third trimester, so that you don't really feel as rushed or confused about, what's next and when is the right time, because that can easily happen.
Mhm.
So I kind of interested in what are some of the side effects or the common side effects that some people experience with birth control, and
Mhm.
what's normal versus, signs to call your provider.
Oh, I love this question. And I love that we're talking about this because in general, birth control is very safe. And birth control is a medication, like all other medications, and they have different side effects on the body. So having a side effect doesn't mean that it's not safe. It means that this is a common thing that people experience in their bodies when they take this medication. So they might be noticing that something different, but it doesn't mean that it is unsafe. And so we talked about the difference between birth control methods having both estrogen and progesterone in them, and then some that only have progesterone. Those are the main 2 buckets of birth control that has medication. And the third bucket is no medication. So non-hormonal. So those are really kind of the 3 buckets of birth control. So I will talk about the combined ones first. So estrogen and progesterone. So with medications that have estrogen and progesterone, so that's the birth control pill, the birth control patch, and the birth control ring. Those are the 3 birth controls that have estrogen and progesterone in them. One of the things with estrogen is it's a really wonderful hormone. It protects our bodies in so many ways. It protects the heart. It protects our skin. It does lots of great things in the body. And sometimes if people have other medical conditions, it can be dangerous with these 3 with estrogen containing birth control methods. So one that can be really common for young people is having migraine headaches where they have something called an aura. So an aura is like when you have a migraine headache, but you might see spots, see floating spots, um, and have a really bad smell or something that feels that is in addition to the headache. So migraine headache. So if you have a headache that's every single day, like after school or after it's been a long day with your child, and you're like, oh, I have this headache, and it feels like a tight cap on my head, and just here, that's not a migraine. So migraine headaches don't happen every day. That's mostly like a tension headache or a stress headache, which is the most common type of headache. I get those too. Lots of us get those stress headaches, and that's at like, oh, it's right here, or it's like right on top of your head, and you might get it every day. You might get it every other day. Those are usually not migraine headaches. Migraine headaches don't happen every single day. Migraine headaches can happen once a month, once every other month, and they come in like waves, we say. And sometimes it can be like maybe just on the left side of your head, like a pounding on the left side, or just on the right side, or in the back. So they have kind of different spaces where you feel them. And usually when people have a migraine, they may have sensitivity to like the light. So light really bothers them. They want to be in a dark room, or sound really bothers them. They may feel nauseated. So that's a sign too. But again, a daily headache is not a migraine. So I want to say that because migraines are a very common thing, but so are headaches. If you have a migraine but you don't get those spots, then the combined birth control can be safe for you. If you get a migraine with an aura, where it's like sometimes people get that migraine and they have like nausea, and they may have need to sit in a dark room, but they also see these little floating spots, or they have like a strange smell, that's called an aura. And estrogen can cause complications when people have migraines with aura. So that's something we always ask young people about. Do you get migraine headaches? And if you get them, do you ever have spots or see floaters or anything that feels something like with your vision when you have that? And if that is, we don't recommend the combined pill. So we only recommend the progesterone only pill. We don't recommend the patch, and we don't recommend the ring. Other common side effects that are side effects that are not dangerous, but can be common with the pill, patch, and ring, because they have estrogen in them. Sometimes at the beginning, there might be a little bit of breast tenderness, similar to when we're about to start our period. So when those estrogen levels are high, or we're seeing the change in estrogen levels, sometimes we have some tenderness in our breast. So we can feel that at the beginning with being on the pill, patch, and the ring. And that's because of the estrogen piece. Um, Usually, and so there's some side effects that people actually really like. So we say, choose your birth control based on the side effects, because usually with birth control, there will be an adjustment to your period. Almost all birth control methods will change your period. And so we talk about, what do you want your period to be like? So birth control that has pill, patch, ring, estrogen, and progesterone in them, usually your period is going to be more regular. So you will know when you're going to have your period. So let's see if I have a sample of a birth control pack let's see, I don't know if I have one. Okay, so let's pretend that this birth control pack that I have here, so this is a progesterone only pill. Well, let's pretend it weren't. So if this were a combined birth control pill, this lower row here would be a different color. And so for the combined birth control, all of the ones up top, the first 3 rows, have medication in them. But then when you get to the other color, those are the ones with no medicine in them. We just say take them so you don't forget to take your pill. And this is when your period's going to come. So usually if you are on a birth control pill that has estrogen and progesterone, your period will always come when you get to that last row. And the birth control looks different. The same for the patch. The box of patches have 3 patches per box, and that's because the patch you change once a week. But usually there's 4 weeks in the month, but you only have 3 patches. So the week that you don't wear a patch is when your period comes. So again, with estrogen, usually we'll know when your period. So some people want to have that regular period. They want to know when their period's going to come. So we say, okay, well, these are the ones you want to think about. For our progesterone only, so the progesterone only is Depo, our progesterone only pills, and then our Mirena IUD. Also, one I forgot to mention is Nexplanon. So that's the implant. So the implant that goes in the arm, actually this is what it looks like, is also progesterone only. It's a little flexible rod. Looks just like that. So that's actually it. And it goes in the arm, kind of in this space here in the arm. So it's about that long, like a small toothpick. And that's also progesterone only. So with progesterone only, your period is not as reliable. So meaning that you may not know when it's going to come, or you may have a little bit more spotting, because the estrogen is what really tells the body that sort of regularity with your period. So side effects. So let's talk about Depo first, because Depo, it can be a very common choice for young people. So with Depo, again, this is once every 3 months. The first Depo shot, usually young people will have quite a bit of spotting at the beginning, and that is what's supposed to happen. So Depo does two things. The Depo causes the inner lining of the uterus to be thinned out. So uterus has to be really cushiony, like a nice cushiony pillow for that egg to stick and grow into a pregnancy. If it's too thin, then it doesn't really allow the best environment for an egg to stick and grow. And so it keeps the lining very thin. And so that's what's kind of coming out. It's like shedding that lining. Again, it's safe, but you will have some spotting at the beginning with Depo. Eventually on Depo, young people's period can actually go away. So after being on Depo for a year, young folks might not have a period, and that's because that lining is really thinned out. So there really is no period there. It's not like your period is up there and it won't come down. Your period is just not there. Once a person stops Depo, everything goes back to what it was before. So these are not permanent things. It does not cause infertility. It doesn't cause you not to be able to get pregnant in the future. It's just for while you're on the medication. The other thing with progesterone is progesterone makes us feel hungry. So with Depo, we're getting a big dose of progesterone because it has to last for 3 months. So we're getting a big dose of hunger too. So I usually tell people on Depo, you're going to feel hungrier. And when you feel hungrier, instead of choosing more fast food or more potato chips, like choose maybe some yogurt or like some veggie sticks or string cheese, like other things that are fruit, things like mix it up, because you will feel that hunger. And so people will often experience some weight gain with Depo. And everyone's body is different. Sometimes it's 5 pounds, sometimes it's 15 pounds, but we can see some weight gain with Depo. And that's all, again, because you do feel hungrier on the medication. And the last one I will talk about is the side effect of having a heavier period. So there is one IUD, the copper IUD. Again, the copper IUD is our IUD with no hormone. And that's the copper that kills the sperm. Sometimes this can make our period heavier. And that's just because the copper creating a little bit of like an irritation inside the uterus. It's not dangerous. It doesn't cause an infection. It doesn't do anything. But for some people, it can make their period heavier. So I usually will tell my young people, I will ask them what their period is like and does it feel heavy to them? Do you ever have clots when you have your period? Are you out of school for many days with your period? And if the answer is overwhelmingly yes, I will say that maybe the copper IUD is not the best IUD for you because it's hard to know whose body is going to have that extra bleeding and cramping, but we know it can be common. So we don't want to make that worse. And again, there are lots of methods to choose from. So if copper IUDs doesn't work for you, maybe try one of the hormonal IUDs or the Nexplanon or condoms and Plan B. So there's lots of different things that can be chosen.
Yeah. Thank you for that. Again, I mean, I feel like we always just kind of thank you for your knowledge because I think we always learn something so new. And I really appreciate that you continuously say that they're safe, right? I think that a lot of people have this conception because their aunt had this reaction and this method didn't work for them, or their friend got pregnant and the baby came out holding the IUD, and all the stories that we hear and see.
Yes.
It makes it feel scary and it makes it feel
Yeah.
unsafe. I also love the framing around symptoms not being it's not that they're unsafe, it's that
Right.
it's a symptom to a certain thing and everybody's body reacts differently. And so
That's right.
that's really important also. I think that some of us, I can be that person sometimes. Sometimes we want to be overly health conscious and, oh my goodness, I couldn't imagine my body going through X, Y, and Z. And then I'm throwing back French fries for breakfast, right? So let's figure this out and let's figure out what I'm really trying to say about my body. So I appreciate
Right.
you kind of reframing that.
Yeah.
Um, another
And also
thing,
that we take medications for other things, right?
yeah,
We
yeah,
take medicine if we have allergies or if we have a cold, and we take medications to take care of our bodies in other ways. Birth control is just a medication that you're using to take care of your body and
yeah,
and for what you want right now. So I love that you said that, Brandy, because it's not a separate thing. It's
mhm,
just another thing. It's
yeah.
another thing for you to care for your health.
Yeah, absolutely. Absolutely. Thank
Mhm.
you for framing it that way too, because I didn't even think about it. Yes, as someone who takes allergy pills every day and takes ibuprofen when I have cramps and whatever else, like why wouldn't I take, this birth control option that fits for me? So I
Mhm.
appreciate that framing for sure. Another thing that comes up a lot, and you mentioned this briefly when you're talking about Depo, and you were talking about this being an effect not getting pregnant for the time being. And so
Mhm.
a concern that comes up a lot among young parents is the idea of planning for baby number two or number three or number whatever, and either there being a delay after stopping birth control or a fear that there will be some sort of long-term fertility um, implications about using birth control. So can you speak to that a little bit, just about what it looks
Mhm.
like to plan a pregnancy after, birth control?
Yes, yes. And this question comes up a lot. And it is often a concern of young women, of adult women, especially folks who've been on birth control for a while or have tried different methods, or you've been on birth control and then are trying to get pregnant and haven't gotten pregnant. And there can be concern that it's the birth control that's causing not being able to become pregnant when you're wanting to become pregnant. So first, I want to say that birth control in and of itself does not cause infertility. It does not. In fact, there about 50% of women who become pregnant and did not expect to become pregnant were on birth control at the time that they got pregnant. So we know that birth control, the pill, folks have become pregnant on the pill, being late for their depot shot, being late for the patch. So again, when we look at this graphic that came out some years ago, and they talk about how well does birth control work, it really is a little bit of a misnomer because they all work well. But the reason why they wrote this is because if you don't use these, if you're not taking them when they're supposed to be taken, you will get pregnant. And so that's why we absolutely know that birth control in and of itself does not cause infertility. Um, One of a very leading cause of infertility actually is chlamydia infection. So we do know that chlamydia does have high rates of more difficulty with pregnancy, infertility over time, especially chlamydia that's untreated. It becomes pelvic inflammatory disease that can cause infertility. So we know I love that we're talking about this because we also that chlamydia can be very common in the youth community as well. And that's one reason why we screen, because we know that chlamydia often does not have any symptoms. And so we want to make sure that we're testing often, that when young people have new partners are being tested or just being tested in general, right? So like it's the tests are very simple, even a urine sample or a vaginal swab, because we want to make sure that we are catching any chlamydia that might be in the vaginal area, to get rid of that very easily, because we do know there are links to infertility with long-standing chlamydia infection. So let's go back to birth control. So with the in terms of maybe delay to fertility or how it affects future fertility, there is one birth control method that we know can have a little bit of a delay, but not even infertility delay. So going back to our friend Depo. So again, we know that Depo lasts for 3 months. And the way that Depo works is an injection that is you often get in your arm, but it's deposited kind of in the fat that's underneath the skin. And so it's a very slow release of the medication over 12 weeks. We do see some connection to a bit of a delay to fertility after stopping Depo. So you may not get pregnant the next month, but maybe it'll happen the month after that. But it's not that Depo causes infertility for years and years, not even 1 year. So we can see that up to one cycle, so 4 weeks, maybe 8 weeks, maybe two cycles to that what we call return to fertility with Depo. Other methods, so the marine IUD, once the IUD comes out, fertility comes back within the next cycle. So when I say cycle, I mean the next month, the next period. Same with the implant. Once the implant comes out, then your cycle comes back. So that ovulation comes back. Also, progesterone only pills. The progesterone only pills are very sensitive, actually. So, with the progesterone only pill, it is really important. You have to take it at the same time every day because your fertility can come back so quickly. So, whenever we're starting the pill that has just progesterone, we always say put a timer on your phone and make sure you take it at the same time every day because there's a high risk of pregnancy if you don't do that. So we know it doesn't have an impact on overall fertility. So really, of all the methods, I would say if someone is like, I want to finish my birth control and I want to make sure I want to get pregnant the next month, then maybe Depo is not the one you want to choose. But there are also a lot of other options. Nexplanon, either of the IUDs, the birth control pill, the patch, the ring, fertility comes back. And I will add to that a little bit because some of the birth control methods, the way that they work is they actually stop your ovulation, so the eggs don't come out anymore while you're on the birth control. Again, that's not unsafe. And some of them do where they increase like the mucus that's around the cervix, so like sperm can actually come into the uterus to fertilize an egg, and then some of them again kill the sperm. So they're just different ways. But to directly answer that question, really Depo would be the only one where there is a bit of a delay in fertility, but it's not months and months and months. Usually 2 cycles. So when I say cycle, that's 2 periods.
Yeah.
Thank you for that.
Before you jump in, Divine, I think that that's important to note because we have had young parents talk about their experience, especially with Depo, right? And the kind of concern about fertility after. And I think it's important for young people and people in general to know that even if you've had a child before, it does not deem you to, have no fertility challenges in the future. So whether you're
Right.
on birth control or you were not on birth control, there could be some other reason why, maybe you're not achieving the pregnancy that you're looking for after finishing birth control. So it's important to see your doctor and talk about some of those
That's
things.
right.
What else may be going on?
That's right. That's right. So checking like hormones, things that can be again common with young moms and in the youth community. One would, if I had a young person coming in concerned about their fertility, I would ask them kind of what that looks like in terms of like what their kind of sexual activity habits are. So how often they're having sex. Then I would think about, again, testing for gonorrhea and chlamydia because we know that long-standing chlamydia is probably one of the most common in youth community that can cause infertility issues. The other is something called PCOS, which can be common in youth community. So that's polycystic ovarian syndrome. It's a very like long and complicated term for something that's actually quite common. That's mostly like a hormonal imbalance in some of the sex hormones. So that's the follicle hormone, the luteinizing hormone, our and insulin levels, and so that it can have some impact on fertility. And usually, young people who have PCOS, they can have irregular periods. So the hormone, because the hormone imbalance with PCOS, could also cause you not to ovulate every single month. And then that's why it can be one of the reasons why you're not getting pregnant when you might be trying. So yeah, so that's exactly right. It really is thyroid would be probably the other thing I would think about for youth community, and how so the thyroid is a really important gland that's right here in the neck, and it controls our metabolism. It also controls how other hormones relate to each other and the surges in our bodies that we need around fertility. And so those are some common things that we will probably look at.
Thanks so much for debunking that. I mean, it's so important in our community because this is an empowering thing to do, for ourselves, for family planning, and it's something that you want to be confident in when making those decisions. So again,
Absolutely.
piggybacking on why it's so important to have these conversations with your doctor, and why it's important to know your body and your needs for during pregnancy and after pregnancy.
Mm-hmm.
I'd love to kind of transition into our social media questions. We have two. The first one is about contraception, reproduction, and the second one is more so about vaginal health and checking in with the provider. So this first one isn't exactly directed in a question form per se, but it's a statement that we would love to get your thoughts on.
Okay.
So somebody on our TikTok said, antibiotics can cancel out birth control. Be careful. My ear infection turned into my now 1-month-old baby.
Okay. Well, I would say as we're debunking myths, I think that is a commonly held myth. So
Okay.
I will say, and so if we do a factor cap, that was we were on the more of the cap
Okay.
end.
Okay.
Yes. So that's a commonly held myth. And we want to acknowledge everyone's experience as well. So we know that it can be common that folks can think that if they're on another medication like an antibiotic, that it will that their birth control won't be as effective. And we know that there is no evidence specifically around antibiotics making birth control ineffective. Um, Sometimes when folks are on antibiotics or they might be sick, it can also be just another life stressor. So it can maybe be harder to remember to take that birth control that day or change the patch on the right time. So we know the most common way that folks get pregnant on the patch is forgetting to put the new patch on. So in between the weeks. So like again, we all have a lot going on in our lives, and sometimes when there's another thing, then it's like, okay, this thing happened. We do know there are some medications though that can make birth control less effective, and that's some of the medications that are used for seizure disorder. So for young people who have seizure disorder, we talk about that. There are some birth control methods that are not, so some of the birth control pills they cannot take because it does make the birth control less effective. So that is definitely something that providers should be talking to their patients about. What are the full scope of our medical picture? Do you have any other medical concerns or issues? And then we have these really great kind of birth control calculators that we can look at and see based on different types of medical conditions. Would this be a good method for you? Are there things we should talk about? Should we use something else?
Thank you. I love that. Myth busting and an
Myth
education.
busting.
We're all about it.
Okay.
Yes.
Okay, so this second one comes from our Instagram, and someone said, what are your thoughts on PAPs for sexually active women and girls under the age of 21 years old? I personally thought this was a really interesting one.
I love this
Yeah,
question. This is a great question.
yeah.
Thank you for the person who put this one out there, because this is probably a question that a lot of young people have, and also like adults as well,
Mm,
because the recommendations have changed over the years.
mm,
So back in the day, maybe like in the 90s, it was recommended that you have a pap smear at age 18. And it was just age 18. That's when you get your first pap smear. And that was recommended based on the evidence at that time and wanting to make sure that we were catching cervical cancer early. So what pap smears do, so it does a swab over the cervix. Cervix looks kind of like a little donut on the lower part. Oh, actually, I have a look at that right there. So we go to so here's our uterus. Can you all see me? Okay.
Yeah.
Here's our uterus. Okay. The lower part of the uterus is called the cervix, and it looks like a little donut. And so when we do the pap smear, we're actually just taking kind of a specialized Q-tip, and we're kind of swabbing it over that donut there. And so it was thought early on that age 18 was the best for that, to start looking for cancerous cells. Because any cancerous or precancerous cells that may happen in the cervix usually can be corrected very early. And if they're caught early, it's something that can be dealt with very early and having no issues. And so really wanting to be vigilant around that. And then the idea changed a few years later that, oh, well, no, just in the year after a young person starts having sex. Okay, so that's what we'll use. 18 years old and the year that they start having sex is when you need to get your first pap smear. And then the evidence shifted with more research, and evidence shifted about 2013, that the age group was age 21. So age 21, regardless of sexual activity, regardless of having had sex prior. So at age 21, if you're having sex, mostly age 21 is the age. And the reason why that is because we know that the cause of cervical cancer, so the cells on the cervix becoming cancerous, is from a virus called HPV. And we folks may have heard of HPV. It stands for human papillomavirus. HPV is very, very common, and there are over 100 strains of HPV. And almost every single person, male, woman, non-binary, however, every person, regardless of identity, who has had sexual sex in the past, or current, has probably come in contact with some type of HPV. So HPV in and of itself is not something that we are so worried about. There are certain types of HPV strains. So there are 4 types that can usually cause some issues or concern. 2 of those types can cause genital warts. They're the most common that cause genital warts. So HPV is also the virus that causes genital warts. And so those are kind of little fleshy skin tags that are around the vagina, around the penis, around the genitalia, that are more of a nuisance and like annoying than anything else, and they can be quite contagious. But they don't usually cause any issue. They're just more annoying, and there is treatment for that. So if you're noticing that you have any kind of fleshy bumps that are not painful but just kind of annoying, maybe they look like moles or larger moles, please go and see your medical provider, and they can take a look and see if it is HPV and offer you different types of treatment. The other 2 types are the most common types that can cause cervical cancer. So we know that cervical cancer comes from the HPV virus, those 2 types. And we know there are hundreds of types of HPV. So over the years with research, they noticed that, again, HPV you only can get it from having sex. And so, and that over time, it was really that at around age 21 is when we really need to start screening for cervical cancer and HPV, because usually before that, we noticed that young women were getting unnecessary procedures that were not catching or any concerning type of HPV. So there was no need to screen younger people. So the answer to that question is yes, 21 is the age, and no, it's not important to get it done before that. Really, it's age 21 and having sex. If a person has never had intercourse before, their likelihood of having cervical cancer is very low, because cervical cancer comes from the HPV virus, which comes from sex.
That's really interesting to know. And it's something that comes up often in our community that people usually have mixed opinions on. I know for myself, being a teen parent, I had my first pap smear, I think, at like 17, 18.
Mhm.
And a lot of people were really confused by that. So thank you for shedding light on that, because
Mhm.
being sexually active and then actually having a child, and things are going on down there.
Yeah,
You would think that you would need to get seen, and some people don't know if they should or not because of that kind of age requirement.
that's right. And I love this question because it also shows that, like, young people want to take care of their health. right? So it's like, oh, do I really need to wait? That's a great question. I love when young people ask that because, like we want young people to know that they're like, you have complete agency over your health and you want to make sure that you are getting the health care that's going to keep your body healthy when you need it. So, please ask and let's talk about it. And if a provider is saying, no, you don't need something, you need to know why. So, and having that detailed information, so that you can trust that medical information is really important.
Yeah. Yeah. Okay. This is a little bit off script, but you know me. You all know me by now. Because I just thinking about HPV and years and years ago, I remember being with someone and she told me that she tested positive for HPV while she was pregnant, though, during the pap smear
Mhm.
while she was pregnant. And then they never kind of did anything about it, waited until after the pregnancy, and then the HPV was
It went away.
it went
Yes.
away.
Yes.
And so that her thought process was, and this was really interesting to me, her thought process was that, and something that she said her doctor shared was that sometimes women will test positive for HPV while they're pregnant,
Mhm.
and it's some sort of phenomenon. Is
Mhm.
that true? Is there any truth to that?
That's completely true. That's completely, and that's exactly why the recommendations changed because the HPV virus is so common, and a lot of times your body will clear it on its own. So a lot of times people have gotten HPV, they didn't even know it because they didn't get the type that causes genital warts. They might have gotten the high risk type, and their body cleared it on its own before they even got their Pap smear. So and so that's exactly what you're saying, Brandy. Is so back in the 90s again, when we were doing pap smears for 18-year-olds, we noticed that they were being recommended for the higher level of screening, like which is called a colposcopy, where you're actually looking at the tissue under a microscope, making sure that we clear out anything that doesn't look that looks like it might be abnormal or concerning. But we also noticed that if we didn't do that over time, that in that age group, the body was more likely to clear it anyway. So there was no need to do that. So that's actually what one of the things that helped support the recommendation to change to age 21. And even in older women, the age is if we see different types of HPV, they automatically go to testing because it doesn't clear as quickly. But it's certainly one with having HPV, different types of high risk HPV, the body can clear it on its own. So sometimes the recommendation is to repeat the pap smear in 1 year. So you just repeat it. And if it's negative in 1 year, then okay, great, body cleared it. And that's a very common thing. That's probably what happened to the person you know. If the body doesn't clear it, then they need to go to the other testing.
Okay.
Another recommendation can be depending on what the high risk type says or depending on what the HPV says. Maybe they need to get a repeat pap smear in 6 months because we want to make sure it has cleared in 6 months. And if it doesn't, then they go to. And then sometimes if they have HPV and it shows different types, like that it's already made some changes on the cervix, then they go directly to having that higher level of evaluation.
And so, okay, so then another kind of question.
Follow up.
My wires are going for someone because as you were sharing, for people who have never had sex, then their risk would be much lower. So for someone who has chosen abstinence for say however long as their form of birth control, what is the recommendation for as far as pap smear for them?
Mhm. The recommendation is still age 21.
Okay.
And we do know that cervical cancer is 100% transmitted through HPV. It is the HPV virus that causes cervical cancer. And PAPs, and the reason why we do cervical cancer screening, pap smears, is to detect cervical cancer. So there's that direct linkage. And the reason why the recommendation remains 21, regardless of sexual activity, because people define sexual activity in different ways. So it's to not have to, we don't want to under sample a young person or individual who really needed to be tested because their definition of sexual activity is different from the medical community's definition of sexual activity that would need cervical cancer screening. So, some people will say like I'm completely abstinent if they're not having certain types of penetration sex. Maybe if they're using only toys or they're using fingers. So it just kind of depends. So as not to miss people who may be at risk, the recommendation remains at 21, regardless of a disclosure of sexual activity. But we do know that if a young person or a patient has not ever been sexually active, any type of penetrative sexual activity, specific types of that, their risk is very low. And I'm not going to say it's not zero, because again, it really depends on how they define that, what the practices are. So it is really more of a conservative recommendation to make sure that we're not missing patients or young people who really need screening.
Yeah, I think that's
Yeah, but
really,
that's a great question, and it comes up. I've had that discussion a lot.
that is very helpful. And I think it's also helpful to know that like during pap smears that they do also kind of check for those different STIs and different STDs. And with pap smears kind of being more so an annual thing, what would you say is a good recommendation for how often someone should be getting tested,
Mhm.
generally for STIs and STDs?
Yes, I love this question. And we know the recommendations around pap smears have also shifted as well too. It used to be annually. You get an annual pap smear. That shifted some years ago to every 3 years, as long as you've had your pap smear has been consistently normal. As long as you've had consistently normal pap smears. So that's like 3 in a row. Then it continued to every 3 years. And now the recommendation is every 5 years. So again, we know that if your pap smear has been normal every 5 years, is your next pap smear. So again, there's always ongoing research and just reevaluating the recommendations, wanting to make sure that we're not over sampling women and having women go through procedures or the processes they don't necessarily need, but to make sure that they are receiving the healthcare at the right time, that they do need it. So one thing you mentioned, Divine, I'm glad you mentioned this, because some people don't know that during your pap smear, your provider can also order STI testing for you at the same time. They can test that when they do the same swab on the cervix. They can send that off for your pap smear. They can send it off for gonorrhea, chlamydia, and trichomonas. So that can be done all at one time. And because the pap smear recommendations are now every 5 years, that if you are having sex, that is too long from being tested again. So we do recommend that that folks are tested regularly for STDs, especially and regularly in different intervals. So I'll talk about that. Anytime you have sex with a new person, any new partner, you should be tested. So and I recommend that's with or without using a condom, because again, condom use can go, like maybe you might have started using the condom, then we might have taken it off, or like it just, and again, and this is no judgment at all. This is just around routine healthcare and like kind of a routine practice, so that you know that, okay, I'm having sex with a new partner. Let me get tested. And also talking to that person or those people, they also should be tested and having a conversation about it. Like, I've been tested and I know that and these are the tests and my tests have come are negative. Can you tell about your test? Have you been tested? Just as like a mutual respect and responsibility around your sexual behavior, your sexual connection. We recommend for prevention that really that testing happens before sex with a new partner. It doesn't always happen that way, and that's fine too. But if you can, being tested before you have sex with someone new, and that they are also tested and you also have a conversation about that. Being tested after, that's great, having that, being tested after. And so the interval is really whenever there's a new partner. So that could be every 3 months if you want. If that happens to be every 6 months, once a year, every 2 months. It just depends on when you're having sex with someone new. The other thing, just for overall kind of routine health, outside of sexual activity or having a new partner, I always recommend at least once a year. So the CDC recommends that young people are tested for gonorrhea, chlamydia. I'm going to add trichomonas there too, annually, and also HIV annually. And so there's having an annual routine as part of your routine health, but then being tested more often when you have a new partner. So that would include HIV testing as well.
Really quick, Brandy, before you jump in.
Yeah.
I just have a quick thing that
Mm-hmm.
it's something that just came to my mind that I've known some situations along these lines, but I kind of don't know the truth myself. So, kind of speaking on the lines of STIs, STDs, talking with your partner, is it true that some people can kind of be receivers but not carriers and can give something to someone but not have it themselves? 'Cause I feel like
Yes.
that happens a lot, or
I heard
people
that
say,
Yeah.
about HPV
Yeah. Yes.
before, but males are
Yeah.
not
So that
necessarily.
is a myth. So on
okay,
our factor cap, that's a cap.
Yeah.
myth
So
busting.
that is a myth. We were busting that myth,
Yeah.
and that is a myth that is very common,
Okay.
and sometimes could be used to kind of deflect
Mhm.
that like where an STI might have come from. And
Mhm.
I want to talk about this kind of globally because I think that I having just a broader discussion around STDs. So I think one is that STIs and STDs, we use them interchangeably. They're really the same thing. So
Mhm.
STD stands for sexually transmitted disease. STI stands for sexually transmitted infection. STI is kind of a newer term, but we really are saying the same thing. And that people get STIs from having sex with someone who has it. And that is it. That is the only way you get them. Not from a toilet seat, not from sharing underwear, not from towels, not from any kind of shared products. That's not how you get it. Only through sex. So if someone was tested and they tested negative and they had sex with a new person and then a month later they tested positive, they got the STD from that person they had sex with. That is the only way they get it. And some people will say, "Well, I can't be a carrier. That's my body is immune to like." Not true. Not that does not exist. It's not real at all. And I also just want to kind of level the conversation around STDs because STIs and STDs are also very common. They're very common. Chlamydia is the most common STI amongst youth community, amongst at young teens and adolescents and teens and young adults. The most common STD because one, it has usually zero symptoms. It's very, very uncommon for chlamydia to have symptoms, and so usually people don't get tested or they don't know because you just didn't know, right? So like getting a STI from someone doesn't necessarily mean they're a bad person. That person's a bad person. They did something. Maybe they did, but maybe they didn't, right? So it really is like, having a more global conversation around kind of your relationship and those kind of things. And STIs also do not mean that a person is dirty. It also doesn't mean that they're clean. It doesn't mean either of those things. It means that they were exposed and acquired an infection that their body could not get rid of on its own.
Yeah.
That is all it means. It has no meaning around a person not having STIs does not mean that person's a clean person or your definition of a clean person. A person who does have an STI does not mean that person's a dirty person or your definition of a dirty person. It just means that they came in contact with an infection that their body could not clear. I think that's something really important so that we can, so we can also reduce stigma around STDs. There can be issues, right? If people have decided that they are going to be in a relationship where they are only having sex with each other and they've only been having sex with each other, and they know that they neither person has had an STI, and then months later one of them gets an STI, well, we know that that came from another person. So that is an issue that it's like we had an agreement that was now broken, and the STI is what gave us the information around that, but it's not linked to whether someone is healthy, clean, dirty, anything like that.
Yeah. Okay, so we're rounding out our conversation, and we have two more questions for you.
Okay.
I hope that's
Okay.
okay.
Mm-hmm.
And I just want to piggyback off of the idea of stigma because you brought that up. And we also brought it up in our part one. There's a lot of stigma around our bodies, right? I mean, even
Mm-hmm.
from a young age, male bodies are constantly being scrutinized. Or are you circumcised? Are you not? Are you this? Are you that? Have you this? Have you that? Female bodies have been scrutinized over this smell or this
Mm-hmm.
whatever action, this look, whatever it is. There's always something, right?
Mm-hmm.
I don't know what the picture perfect standard is. I've never learned that, but I just want to kind of continue on that train and talk just briefly about things like BV and UTIs and yeast infections and things like that. And what are some things that are commonly misunderstood about that? Because I think that especially for, as a woman, I know that the messaging that has been shared is that also means you're dirty if you have a yeast
Mm-hmm.
infection or you have a this, or what are some of the things that people should be looking out for, and what are some of
Mm-hmm.
the misconceptions that we can kind of
Yes.
debunk?
Yeah, I love this question, because there's so much stigma around sexuality, and we learn it at a very young age, and it's so interesting because in the same way that we learn about at different developmental stages around like appropriateness in the world, like how to tie your shoes and how to eat with a fork and how to use a napkin. We also learn very negative things at developmentally appropriate ages. So we learn that, like, oh, if you smell a certain way, something's wrong with you. Or if you have sex with more than one person at a certain age, then this is this thing about you. Or, oh, you had an STD, this thing about you. So that the stigma just piles on itself around our sexuality. And most all of those things that we learn are not true. It literally is just myths that have created this large stigma and shame around our sexuality and around sexual behaviors. So let's talk about sort of just vaginal health and the different ways that our vaginas and discharge and those things are. So I love what you said, Brandon, around like, I don't know what the perfect standard is. And I love that because there isn't one. Like, all our bodies are all different in all the ways. We're all different on the outside, we're different on the inside. Our bodies react to medication differently. Our organs react to different things differently. We are all unique in our ways, and our our vaginal area, our vaginas are also unique, and the discharge is also unique. And so I always say that to young people that, one, your vagina cleans itself, does not need help from us. It doesn't need help from douching. It doesn't need help from vaginal soap. That's not a real thing. There's no such thing as vaginal soap. It doesn't need vaginal soap. It doesn't need vaginal products. It doesn't need vaginal powders or gels. It doesn't need any of that because the vagina cleans itself. It has its own set of bacteria in the vagina that keeps the vagina healthy, clean, at its own pH. And so the pH is kind of about the balance of acid that's in the vagina that keeps it healthy. And the bacteria that lives there normally is what does that. And so our vaginas and their discharge has a smell, and it should smell like our bodies. So I always tell people when they say, oh, there's a strange smell, I'm not sure. The first thing I say, does the smell like you, or does it not smell like you? And almost every single time, young people know exactly what I'm talking about. They're like, oh, yeah, no, it doesn't smell like me. Oh, no, it smells like me, right? Because we know what our bodies smell like.
Yeah.
So if so, what should alert us that something may be off or may need some support with is if your body doesn't smell like you. If your vagina doesn't smell like you. So our vagina should not smell like roses because it's not a rose bed. It just smells like our bodies. It just smell like our bodies and what we normally smell, how we normally smell, not our friends, us. And when we know our normal smell, when our normal discharge is like what's normal for us, we will know what's not normal for us. So then the next thing I say, well, okay, if it doesn't smell like you, then describe to me what it smells like. And then sometimes people will use different terms and they may say, oh, it's a fishy odor. I'm not really sure. Just it has a really strong smell. So some of the things that can cause these really strong smells that don't smell like our own bodies are something called bacterial vaginosis, BV. BV is probably one of the most common conditions that can make the vagina not smell like the way it normally smells. So a BV is not an STD. It is very, very common, and it is an overgrowth of other types of bacteria that don't normally live in the vagina. And the way that BV happens is usually because that good bacteria that cleans the vagina out somehow was killed off and other bacteria grows. The things that can kill off that good bacteria are vaginal soaps, douching, vaginal creams that are not like yeast creams, vaginal creams to make our vagina smell like roses, different types of vaginal products, because our vagina does not need vaginal products. So it will kill the good bacteria and make these other bacteria grow. Other things can be blood. So from our period, because blood can change the amount of acid that's in the vagina. And so sometimes people will get BV around the time of their period because that changes. The other thing that's really common is sperm. So sperm can do it too. It can change that acid content. Not dangerous, just annoying. So for bacterial vaginosis, again, is not an STD. It's really common, but it's mostly like we know our bodies. So if your body doesn't smell like itself or there's more discharge you normally have, go see your medical provider. It is important to clear bacterial vaginosis because with that type of bacteria, it can leave an environment for other infections to grow. So we do usually we give medication for that. And the last thing I'll talk about is yeast infections. So yeast and yeast infections can also be very common from those same things. So mostly using vaginal products that kill the bacteria. So again, no vaginal products. If you go to the drugstore and says vaginal soap, walk away.
Run.
Walk away. Don't do it. Don't do it. Just use water. The vagina, just use some water. Just put water there. If you really want to put something there, just use some water. Water's fine. Don't do anything else. And people will say, but what if I just had like even my own odor is kind of strong. So yes, it smells like me, but it's kind of strong. Usually that's coming from the hair on the outside of the vagina. You can put soap on the hair. So like I'll say if you're in the shower, so you'll stand up straight, just put soap on the hair area, rinse it off. Then you can put some water inside your vagina, but you don't put soap inside the vagina, just on the hair. That's totally fine. UTIs, same thing. So urinary tract infections are very, very common, can be caused by lots of things. The most common in young people is actually bacteria after sex or during sex, because the vagina, so there's kind of like 3 holes there. I'll just talk about 2 of them. So the hole for our vagina, then we have another small hole right there. That's where we pee, and that's the urethra. And then we have another hole there, and that's where we poop. So that's the anus. So the hole that's right above the vagina. So during sex, the bacteria on the outside of our skin can pass over that hole and go right up the urethra. And so that can cause an infection. So we say urinate after sex, pee after sex, clear out any bacteria that might be around the urethra, and that's a really great way to avoid urinary tract infections.
Thank you so much for that. And I really love that you said vaginas clean themselves, because it's so funny for me personally. Those vaginal soaps do the opposite. They give me BV, they give me
Yes,
infection. And it's like,
that's right.
the whole propaganda social norm is to smell like roses and candy.
Yes.
Things, but I'm so glad that you put an end to that because it's tempting when it works
It
for
is.
some people, but you know what works for your own body. So
That's
I
right.
really love that. And I love how you mentioned peeing after sex because I was going to ask you about that. I heard and I didn't know. So
Yes, it is very effective. Yes.
I appreciate it too. This is it's no secret. I have a teenager and we were just having this conversation around pH balancing this and this product. And, well, I want to try this and I want to try that. And I'm like, no. So I'm going to send her your way, Dr.
Yes,
May.
right.
I'm like, we are having the same conversation. Vaginas clean themselves and all this. It's that age where, all of this kind of propaganda is being thrown at you from all these different places. No, I'm not buying any of those products. Absolutely not.
That's right. That's right.
I already paid the
We
water
don't need
bill.
it.
All you need is
We
the
don't need
water.
it. Yes,
the
we
water
don't need
bill's
it.
high enough.
That's just the water bill. Just use water. Just the water bill.
So thank you again so much. Our conversations are always going to have to be continued because there's so much more that we can talk about always.
I'm here for it. I'm here for it.
So if you have more questions for Dr. Mays, always send them our way. And, thank you again for all of your nuggets of wisdom. We really appreciate it.
Aww.
And our platform would not be what it is without your input. You were one of our first guests, if not our first guest. And from then we have just kind of blossomed. And so I really appreciate you and hope that we can do some in-person stuff one day.
Yes, absolutely. I appreciate you all so much. And maybe we'll do something during Black Maternal Health Week in person.
Yes,
That would be amazing. Thank you all so much for having me. I love our conversations. I just love our flow. And I really hope that this was helpful to the young people who are watching this. Like Brandy said, please submit more questions. We're here to be a resource. If you also need to check in at Dream Youth Clinic, we also do telemedicine. So we can see you for a telemedicine appointment, all for free. Send us a DM on Instagram, Dream Youth Clinic, or TikTok, Dream Youth Clinic. We're happy to support you as well.
Yes. Thank you.
Thank you.
Thank you. See you all next time.
Bye.
Bye.
Dream Youth Clinic is a dynamic, creative, and innovative youth-led and youth-inspired organization dedicated to serving the most vulnerable youth of the Bay Area and beyond. For more information, check out their website and follow them on all social media platforms. And as always,
If you enjoyed the Up podcast, please subscribe, share, and leave a comment.
and visit youngunitedparents.org for the information, community, and resources young moms and dads need to thrive.